Why do Americans pay more for healthcare than any other nation, yet have the lowest life expectancy among wealthy countries? The answer lies in the unique aspects of the U.S. healthcare system. Doctors are rewarded more for medical procedures than for keeping people healthy. Costs are hidden from customers and money is spent on tasks unrelated to patient care. Harvard economist David Cutler highlights the absurdity of spending more on administrative costs than on heart disease and cancer care. The nation's rising health bill affects everyone, with health insurance costs outpacing wages. Health bills are the leading cause of personal bankruptcy in the U.S. Medical bills accounted for over half of all consumer debt in 2022. Public anger over high costs and poor results has been focused on the health insurance industry. The assassination of United Healthcare CEO Brian Thompson has intensified this frustration. Senator Elizabeth Warren acknowledges the public's visceral response to feeling cheated by insurance companies. Health economists argue that the entire healthcare system deserves scrutiny for runaway medical bills. Health insurance companies made $25 billion in profit last year, while hospitals collected $90 billion. Most U.S. hospitals are non-profit and receive tax breaks, yet many don't fulfill their charity care obligations. Johns Hopkins and Texas Christian University researchers found that non-profit hospitals were spared $37.4 billion in taxes in 2021. Meanwhile, these hospitals paid out only $15.2 billion in charity care. Doctors and hospitals are paid based on the number of tests and procedures, not patient outcomes. This fee-for-service model rewards quantity over quality. Specialists like cardiologists and cancer doctors receive much higher payments than primary care doctors. This system skews incentives towards treating complex conditions rather than preventing disease. Administrative costs are a significant source of wasted medical spending. Harvard's Cutler estimates that up to 25% of medical spending is due to administrative tasks. Healthcare pricing remains a mystery, with patients often unaware of costs before receiving care. An MRI can cost anywhere from $300 to $3,000, and a colonoscopy from $1,000 to $10,000. Americans pay far more for prescription drugs than people in other wealthy nations. U.S. prescription drug prices are over 2.5 times higher than in 32 comparable countries. Private equity firms have taken over hospitals and large doctor practices, prioritizing profit. The bankruptcy of Steward Healthcare highlights the impact of private equity on healthcare. Federal regulators have scrutinized private equity's role in inflating prices and reducing provider choices. The tragic shooting of an insurance executive underscores the flaws in the U.S. healthcare system. United Health Group CEO Andrew Whitty acknowledges the system's shortcomings and public frustration. The American healthcare system is in dire need of reform to ensure better outcomes and lower costs for all. The insurer pays the doctor, hospital, or lab based on negotiated in-network rates between the two parties. Doctors, hospitals, and other providers are paid based on the number of tests and procedures they order, not necessarily whether patients get better. A lot of that can be explained by the unique aspects of our healthcare system. Americans spend far more on healthcare than anywhere else in the world, but we have the lowest life expectancy among large, wealthy countries. Among other things, we reward doctors more for medical procedures than for keeping people healthy, keep costs hidden from customers, and spend money on tasks that have nothing to do making patients feel better. We spend more on administrative costs than we do on caring for heart disease and caring for cancer, said Harvard University economist David Cutler. It's just an absurd amount. The nation's rising health bill affects just about everyone. The amount working-age Americans spent on health insurance through the payroll deductions has jumped nearly 3 times faster than wages over the past 24 years. And medical bills accounted for more than half of all debt on consumers' credit records in 2022. According to the Consumer Financial Protection Bureau. Health bills are the leading cause of personal bankruptcy. Public anger over high costs and poor results has been squarely focused on health insurance industry in the wake of the assassination earlier this month of United Healthcare CEO Brian Thompson. Massachusetts Senator Elizabeth Warren said that while violence is never the answer, the public's frustration should serve as a warning for the healthcare industry, and in a Huffington Post interview last week cited the visceral response from people who feel cheated, ripped off, and threatened by the vile practices of their insurance companies. But health economists say the entire healthcare system, not just insurers, deserves scrutiny for runaway medical bills. Health insurance companies took in $25 billion in profit last year, while hospitals collected an eye-popping $90 billion. It's become quite clear how angry the public is with healthcare costs. I'm glad people are voicing their anger against insurers, but they should be directing equal anger against hospitals, particularly since so many are nonprofit. Here are 7 reasons America's healthcare costs are so much higher than everyone else's, without showing better results. Reason 1. Lack of price limits. U.S. hospitals have more specialists than do medical facilities in other nations. Having access to 24/7 specialty care, particularly for hospitals in major metro areas, drives up costs. Patients have more elbow room and privacy here. U.S. hospitals typically have either 1 or 2 patients per room, unlike facilities abroad that tend to have open wards with rows of beds. He said differences in labor markets and regulatory requirements also can pack on costs. Of the $4.5 trillion spent on U.S. healthcare in 2022, hospitals collected 30% of that total health spending, according to data from the Centers for Medicare and Medicaid Services. Prescription drugs accounted for 9%, and health insurance, both private health insurance and government programs such as Medicare and Medicaid, collect 7% in administrative costs. Doctors rank second at 20%. Most U.S. hospitals are nonprofit and get federal, state, and local tax breaks. These nonprofits are expected to provide free or reduced cost care to low-income patients, as well as other community benefits. Federal law requires hospital to assess and stabilize every patient who seeks care in an emergency room, even if they can't pay their bills. But research suggests many hospitals don't live up to their charity care and other community benefit obligations. Johns Hopkins University and Texas Christian University researchers estimated the nation's nearly 3,000 nonprofit hospitals were spared $37.4 billion in federal, state, and local taxes in 2021. That same year, Medicare filings show hospitals paid out $15.2 billion in charity care. Proposal healthcare price caps to curb runaway health costs has been suggested. Such caps might be used in markets where large hospitals control a significant share of a local health market, which allows them to demand higher prices from insurance companies who might not have other options. Reason 2. Hospitals and doctors get paid for services, not outcomes. Critics of this fee-for-service payment method says it rewards quantity over quality. Health providers who order more tests or procedures get more lucrative payments, whether the patients improve or not. This is not the way healthcare should be delivered in our country. We need to explore an alternative health payment called value-based care. After the Affordable Care Act passed in 2010, the Centers for Medicare and Medicaid Services funded small programs that encouraged hospitals and other health providers to emphasize value over volume. But the U.S. health system has been slow to adopt value-based care programs. Of 50 such models launched by CMS over the past decade, only 6 delivered health savings and 2 demonstrated improvements in quality. Reason 3, specialists get paid much more and want to keep it that way. Doctors who provide specialty care, such as cardiologists or cancer doctors, get much higher payments from Medicare and private insurers than primary care doctors. Some see that as a system that rewards doctors who specialize in caring for patients with complex medical conditions, while skimping on pay for primary care doctors who try to prevent or limit disease. Under the current system, doctors chosen by the American Medical Association recommend how much Medicare should pay doctors for specific services. Some have compared the idea of doctors setting their own pay scale to the proverbial fox guarding the henhouse. The health news publication Stat first reported that Robert F. Kennedy Jr., President-elect Donald Trump's nominee to become Secretary of Health and Human Services, is seeking to limit the AMA's influence over these medical billing codes. Medicare payment rates not only determine how much taxpayers shell out for older Americans' health care, they set the base for health care prices. Private insurers typically use Medicare rates to decide how much they pay doctors and hospitals. If such an overhaul resulted in more lucrative payment for primary care doctors who emphasize preventive care, it could help make people healthier and reduce costly spending on specialists. Reason 4. Administrative costs inflate health spending. One of the biggest sources of wasted medical spending is on administrative costs. Although Medicare's official healthcare spending report doesn't calculate how much the nation spends on administrative tasks, it is estimated that up to 25% of medical spending is due to administrative costs. Health insurers often require doctors and hospitals to get authorization before performing procedures or operations. Or they mandate step therapy, which makes patients try comparable lower-cost prescription drugs before coverage for a doctor-recommended drug kicks in. These mandates trigger a flurry of communication and tasks for both health insurers and doctors, Cutler said. Although medical records are computerized, too often medical computer systems don't communicate with outside organizations such as health insurers. That results in extra administrative tasks when doctors attempt to get authorization from an insurer on behalf of a patient. Such communication could be more seamless and result in less busy work if insurers could track patients' records electronically. Instead, they often turn to calls and throwback technology such as fax machines. The only use of fax machines now are in medical care. Government-run Medicare is a much more efficient operation. Doctors who provide care for Medicare patients are allowed to bill and collect payment in relatively seamless transactions without the same level of oversight that private insurance companies apply. One drawback: unscrupulous providers can more easily fraudulently bill the federal health program. Reason 5. Healthcare pricing is a mystery. Patients often have no idea how much a test or a procedure will cost before they go to a clinic or a hospital. Healthcare prices are hidden from the public, and because consumers with health insurance often must pick up a portion of their bill, healthcare prices matter. An MRI can cost $300 or $3,000 depending on where you get it. A colonoscopy can run you $1,000 to $10,000. Economists cited these examples of wide-ranging healthcare prices in a request that Congress pass the Healthcare Price Transparency Act 2.0, which would require hospitals and health providers to disclose their prices. Under a law that passed Congress during Trump's first term and was enacted under the Biden administration, hospitals must disclose cash prices and rates negotiated with health insurers for a broad list of procedures in a computer-readable format so the information can be analyzed. The rule also mandated hospitals post estimates for at least 300 services so consumers can compare prices. However, the consumer nonprofit Patient Rights Advocate said in a November report that just 21% of hospitals fully comply with the existing federal price transparency rule, down from 35% as of February. Reason 6. Americans pay far more for prescription drugs than people in other wealthy nations. There are no price limits on prescription drugs, and Americans pay more for these life-saving medications than residents of other wealthy nations. U.S. prescription drug prices run more than 2.5 times those in 32 comparable countries, according to a 2023 HHS report. In one study of 224 cancer drugs approved by the Food and Drug Administration from 2015 through 2020, the median price for a patient was $196,000 per year. During a September hearing, Senator Bernie Sanders grilled Novo Nordisk's top executive over why U.S. residents pay so much more for these medications than people in other countries. Lawmakers have scrutinized prices of weight loss drugs such as Ozempic and Wegovy. Although the amount consumers pay at the pharmacy is often discounted, Novo Nordisk charged $969 a month for Ozempic in the U.S., while the same drug costs $155 in Canada, $122 in Denmark, and $59 in Germany, according to a document submitted by Sanders. Reason 7. Private equity Wall Street investors who control private equity firms have taken over hospitals and large doctors' practices with the primary goal of making a profit. The role of these private equity investors has drawn increased scrutiny from government regulators and elected officials. One example is the high-profile bankruptcy of Steward Healthcare, which formed in 2010 when a private equity firm acquired a financially struggling nonprofit hospital chain from the Archdiocese of Boston. The chain is led by a former heart surgeon who collected more than $100 million in compensation and bought a $40 million yacht, while employees at Steward Hospitals complained about a lack of basic supplies, according to a Senate committee. Layoffs and hospital closings followed. Private equity investors also have targeted specialty practices in certain states and metro regions. Last year, the Federal Trade Commission sued U.S. anesthesia partners over its serial acquisition of practices in Texas, alleging these deals violated antitrust laws and inflated prices for patients. The federal agency also sued private equity investor Welsh Carson that funded these deals, known as roll-ups, but a federal judge in Texas dismissed Welsh Carson from the case. FTC Chair Lina Khan has argued such rapid acquisitions allowed the doctors and private equity investors to raise prices for anesthesia services and collect tens of millions of extra dollars for these executives at the expense of Texas patients and businesses. A National Bureau of Economic Research paper by researchers from Yale, Northwestern, and the University of Chicago shows 18 metro regions where such serial anesthesiology acquisitions, known as roll-ups, resulted in fewer provider choices and higher bills for consumers. The tragic shooting of an insurance executive has highlighted the distinctive aspects of the nation's healthcare system. We know the health system does not work as well as it should, and we understand people's frustrations with it.